Busy hospitals to busy doctors' offices, the pandemic is putting a strain on the healthcare system across the country.
So who do you send to the hospital and where do you send them? It's a tough call for one town in Nye County where the closest ER is 100 miles away.
It's at least almost doubled. That's just patient visits.
Almost double the number of patients a day, from the common cold to the flu.
If we were to count COVID tests, depending on whether we have a really large surge or not, you can add another 26 to the week. I have a very, very loyal team. I have a team of 4 people, and that's not very big. So, it can be at times very overwhelming. COVID is about getting the care early. People survive it if they can get health care in a timely fashion.
Keeping people out of the hospital is important for Tonopah Primary Care nurse Elena Peterson. The only rural hospital there closed back in 2015. So if a COVID patient or anyone else sick needs a transport, it's 100 miles away to an ER. Or patients could head to Pahrump, the Vegas area, or Reno. With hospital beds and staff scarce across the state, the Nevada Hospital Association says paramedics and ambulances are busy.
We do also end up with the air flights at times as well. If they need a ground transport, you have a limited team to get them down the road. If you have multiple patients at the same time, that has to be a priority, and you may end up with someone waiting for a few hours. There are times where we're doing stabilization and a little bit more of a wait than we would normally do.
Peterson says the work lately is exhausting, but it is very important to serve this underserved area.
The overwhelming gratitude is very, very satisfying.
Nurse Peterson says more people have been willing to get the vaccine in recent months. She says her patients do so because they do trust her as their provider.